So let's talk a little bit about blood pressure and glucose control. Blood pressure is extremely important in diabetes to prevent long-term complications, and as a minimum should be taken at least once a year, more often if possible. As particularly, it's worth having a meter at home and every now and again just doing that blood pressure and bringing it to the attention of your healthcare professional if it's too high. And we know that good blood pressure control will reduce the risk of long-term complications from diabetes and can also reduce your risk of heart disease and stroke. And as well as blood pressure being reduced through weight loss and exercise, medication is sometimes also used if we're unable to attain the blood pressure that we need through those routes. And sugar control and glucose control, this is what you measure when you're using your little home machine with the strips, and that gives you a moment in time of what your blood glucose is doing. What your healthcare professional does is use a test called an HbA1c, which basically looks for the way that glucose is attached to your red blood cells, and it gives us an idea of how well your blood glucose has been controlled over approximately the last 8 to 12 weeks. And again, our blood glucose, as we've talked about, can be controlled through both lifestyle improvements such as what we're eating and what we're doing, and also with medication. So measuring blood pressure is certainly something that you can do at home, and may indeed be something you've done during the coronavirus lockdown, as you've been unable to access the medical treatment you might normally have. And they are the monitors nowadays are very easily available online or at your local chemist, and can provide extremely good results and are very helpful. So may well be worth purchasing one of your own to be able to check your blood pressure. If you're doing it at home, aim to do it at roughly the same time every day. Wear a top with loose sleeves, which can be easily rolled up to expose your upper arm. You don't want the sleeve to be cutting off your circulation, so make sure it's quite loose, or that could affect your blood pressure readings. Make sure you're sitting comfortably in a chair and feeling relaxed, and you might need to sit there for 5 minutes quietly or so before taking your blood pressure. If you can, try and rest your arm on a cushion or a chair arm so that it's around the level of your heart. When taking your blood pressure, obviously, roll up your sleeves, stretch your arm out straight with your palm facing upwards. Place the blood pressure cuff around your bare arm, making sure it's the right size, and it should fit quite nicely in the central part of your arm, and there should be sort of a couple of centimeters above your elbow there to the cuff. Don't pull it too tight. You should be able to fit a couple of fingertips under there. And in terms of the cuff, it needs to be the right size. If it's too big, the blood pressure reading will be too low, and if it's too tight, it could make the blood pressure reading too high. Once you're sat there, you've got the cuff on comfortably, press the start button on the monitor and with your other hand, and then don't talk or move. Sometimes I find myself chatting to people, but that will put their blood pressure up. So it is hot. You need to sit there, not talk, be quiet whilst it's taking the reading. You'll feel the cuff tighten, and then it will start to slowly deflate, and then the blood pressure reading will appear on the machine. And often people ask me, well, what do those readings mean? And essentially the top number is what we call the systolic blood pressure, and that's the pressure at which the blood is being squeezed out of your heart. And the lower number is what we call the diastolic blood pressure, and that's the pressure in your heart once the muscles have relaxed. And both of those numbers are important. Essentially, generally, you're aiming for a number around 140 or less for the top number, and for the bottom number, around 80 or less, ideally.